Good morning. I'm Dr. Jessica Sapoff. You're listening to Dental MD radio show. And on this show, I talk about topics in dentistry that, in a way that you might not otherwise get to hear. Because dentistry is dentistry. We are doing all the same things in a holistic office that, well, maybe not every single same thing, but generally the same things: fillings, crowns, partial dentures, all that kind of stuff, dealing with missing teeth and doing oral cancer screens, exams, looking for decay, doing sealants, all that stuff. Same basic stuff. But in a holistic office, everything is done with a different, kind of a different attitude, a different consciousness about how what we're doing or not doing affects your entire rest of your body. And someday dentistry might be reconnected with medicine where it belongs as a specialty in medicine, because it's a surgical specialty and it's in a specific area of the body. But for some reason, there's sort of this attitude like you have your body and then there are also those teeth and those ears and those eyes, and those are like, not... It's almost like even though there are specialists for those areas, dentists, optometrists, ophthalmologists. The ophthalmologists do surgery and the optometrists deal with vision, but they are doctors. Optometrists are doctors, OD, and I don't remember exactly what that stands for, but it's a doctoral level degree, and as is dentistry. And anyway, for some reason, these three areas, the eyes, the ears, and the teeth, have been relegated to a separate insurance category. And, you might have medical coverage, but do you have vision and dental? And it's like they're separate. They're not part of your body. So that is, I don't know exactly when that started, but it seems like, to me, the proper position for those body parts is reconnected with the body, and everything that's done in those areas should be done as part of medical practice. So now what's happened to medical practice in this country and probably other places as well, in that it's been kind of, I'll put it this way. It's hard to find a physician practicing in a small office as an owner of the business. You just don't see that very often. Usually they're practicing in hospitals or in large groups, corporate settings, HMOs, all that kind of thing. You just don't see individual independent practitioners in medicine very often. And you still see independent practitioners in dentistry, but not as much as in the past. Because with corporate dentistry structures becoming more and more common, dentists getting out of school will go and work for a corporation and get benefits and time off, paid vacation, all that, all the perks of working for a large organization that can afford to give benefits and regular pay. And for a lot of people, that is easier than owning your own office. However, those corporate structures are not, they're profit oriented, and they're not interested in saving you, the patient, from having to have a procedure because obviously they're set up to maximize profit. And so if I were working in one of those places and I was saying, well, if we just do this, then you won't have to get that crown or, whatever, they'd be looking at my numbers and sitting me down and saying, hey, everyone else is doing this many crowns every month and you're not. Everybody's doing this many deep cleanings on perio patients a month and you're not. I think I'd probably not last very long in an environment like that. So as a holistic practitioner, I pretty much have to have my own practice in order to do things the way I think they should be done. And The standard of care is the same in terms of, when a crown is placed, the margins should be closed. There shouldn't be any openings. The cement should be where it belongs, and all of those things. The occlusion needs to be right. The flossing contacts need to be right so you don't get food stuck. Those are all basic clinical standards of care. Those things are the same whether you're a holistic dentist or a mainstream conventional dentist. However, how much I drill away your tooth may be different. How I design your crown, or maybe make an onlay instead of a crown so I don't have to drill away as much of your tooth. The materials I choose are not chosen for, how cheap the lab bill is going to be for me. They are chosen according to what is the most biocompatible materials, and sometimes usually that costs me more to do it that way, and my fees have to cover those expenses that we have for using the kinds of materials that we use. And so the entire thing is just, done differently with a different end in mind other than the usual ones, which is closed margins and proper cementing and occlusion and flossing contacts and contours and all that stuff, which is the same, but the things that are different are different. And I have the freedom to do things that way more conservatively for you. I'm not going to leave a mercury filling underneath your crown, for instance. If I find one in your tooth, that's going to be safely removed. But, it's harder to find physicians, and getting harder and harder to find dentists that are practicing independently. Now, you might go to a dental office and the dentist's name is on the door and it looks like a small private dental office, but there are management companies. So they may not have the corporate name on the door, but there's a corporation managing that practice that the dentist has sort of hired to manage things. But what they do is they come in and they look at your numbers and they tell the dentist, okay, you need to do more of these and don't do so much of that. And, your numbers are like this. And you need to call all the patients that you said needed a crown and tell them that they need to get in and get those crowns because you need to get your numbers up. You're not doing enough crowns. And so they're kind of managing the numbers for those dental offices and helping them cut corners and helping them keep their expenses down. No, you can't buy that kind of glove. You have to buy these gloves. These are what are on sale this week. You can't buy that resin filling material. You have to use this stuff. It's on sale this week. And to these conventional dentists, it doesn't matter which composite, except for, is it easy for me to put in your tooth, and how long does it take to cure this one versus that one, because that 10 seconds times 52 weeks a year adds up to like a day and a half of curing stuff. So if it cures faster, then you save a day and a half of time that year. I mean, really, I'm not joking. It's come down to this in terms of, choices made in dental offices. Now, in a holistic office like mine, I'm not looking at things from that perspective. I'm buying the materials that I believe are the least cytotoxic. And trust me, those are not on sale. I don't know if they've ever been on sale. Sometimes there's a special. You can get one extra thing if you buy, $1,000 worth or something. Anyway, it's never been cheap buying that kind of materials. But, I have a standard that matches the holistic medical and dental community in terms of what I select to use in your mouth and bond to your teeth, which is going to be in your mouth for a long time. So, and plastic is plastic. You might opt for ceramic instead of plastic because of not wanting so much plastic in your mouth. And then there are plastics that are high quality and plastics that are mediocre, probably, in terms of quality. But if they bond to your teeth and they stay put and you don't get sick within a period of time that could be traced back to that material, then it's deemed biocompatible by the authorities in place at the moment, mostly the American Dental Association, which accredits and approves materials for use. But that's a whole nother story about whether you're going to trust the current authorities that are in place. But there are other organizations that are also checking and testing. These are not mainstream, and they are not, and most dentists wouldn't even know about them because they haven't looked into it. And they don't see why they should, because the authorities they trust haven't told them, gee, have a look at this other thing over here. Gee, that's interesting. They have not been told to go or directed or given any links or other information other than what the current authorities believe is what dentists need to know right now for practicing. So anyway, conventional versus alternatives. During this show, I'm going to talk about different areas in dentistry and how a holistic office such as mine will give you information and help guide you to understand what the differences are. Because if you choose to have something done in a more conventional way, that's fine. There's nothing wrong with that. It's just it may not be something I do or, a service I provide, and that's fine. I will give you referrals and make sure you get where you need to go to get the treatment that is your preference for yourself or your family. And there's absolutely nothing wrong with that, and I'm all for it. What I want is for you to get the care you want, not the care I might make money on. I don't look at it that way. When people come in and have treatment done, that's when I earn my living and pay my bills. And if my schedule is full, then the ends will meet. And in there during my weekday, if somebody chooses something and it isn't something we do, that's fine, because my schedule will fill up with somebody who does want something that I do, and that's fine with me. My goal is for you to get the care you want, and I'm going to let you know what all your choices are so that you can do more investigating, do more research, get other opinions, and make a decision for yourself and or your family. So that's another thing that's a little different about my practice anyway. I don't know that all holistic dentists are quite so generous with, whatever you want to do, that there's another dentist up the street that will do that for you. Why don't you go there? I don't know that I'm like the Macy's Santa Claus of dentistry, I guess. Anyway, you're listening to Dental MD. I'm Dr. Jessica Sapoff, and if you have any questions about the things that I'm talking about today or on any of my other archived shows, please give us a call, 425-427-8899. And you can also reach us by email, appointments@naturaldentist.com. All right, I'll be right back after this break.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Pets bring so much joy to our lives. They're loyal, they're protective, and smart. Yet as smart as our pets might be, they can't advocate for themselves, especially in the event of a natural disaster. Hi, I'm Sean Lowe. Last year during Hurricane Harvey, I saw the impact of natural disaster firsthand. Many families suffered the added heartbreak of being separated from their pets. That's why it's important your pet is part of your family's disaster preparedness plan, like storing pet food, medical records, and supplies in waterproof containers. Proper identification, a microchip, and a photo of you with your pet can help in case you get separated. And keep their favorite comfort toy handy. If you take steps now, you'll encounter less stress during the chaos of an emergency. To learn how you can prepare your pet for a natural disaster, talk to your veterinarian and visit banfieldfoundation.org/disaster. That's banfieldfoundation.org/disaster. Don't save it for a rainy day.
Get your daily dose of variety. Alternative Talk 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today I'm talking about conventional versus alternatives in choices in dentistry. And, in the last segment I talked about, standards of care that the Dental Quality Assurance Commission or Dental Board of the state, the things they look for to, if there's a complaint, they look at the x-rays and check and see whether decay or an open margin or a root canal that isn't completely filled, things like that. They're looking for basic clinical competence, and all dentists are expected to meet that criteria for each kind of procedure. And that's what we're trained to do in school. That's what, competency and board exams and all of that stuff are supposed to screen out people who do not have the ability or understanding to meet those basic standards. So, that being said, there's much more to dentistry and to choices in dentistry than just basic competence. And in holistic dentistry, the practice is based on the principles of natural medicine as opposed to conventional, or what would sometimes be called Western medicine. And even within natural medicine, there are a lot of different ways to think about it. Some natural practitioners have simply substituted pharmaceuticals with nutraceuticals. So they're using herbs and homeopathics and tinctures and other substance, vitamins, minerals, foods, diets, any of that kind of thing as a substitute to help with symptoms of disease processes or breakdowns, physical breakdowns. And those things are useful and helpful, and they have their place, but there is more to natural medicine than just simply substituting a drug designed to help with a symptom with a supplement designed to help with the symptom. Somewhere in there has to be a diagnosis and hopefully a way to assist your body in healing, not just in dealing with symptoms. So healing and curing are things that are really not highly profitable, because the second you really solve a problem or the problem goes away or the body heals something, then that person is no longer under a long-term management plan for that problem, which means that they don't need you as a practitioner anymore. So if somebody's goal is to diagnose and do what's necessary with some either intervention, procedure, substance, whatever it is, hypnosis, whatever it takes to solve the problem and have the body really heal a thing, that is not very profit-oriented. And it's really not the main emphasis in a lot of practices, partly not because they don't want to help and cure and have things heal. The practitioner isn't the one doing the healing. You are, by the way. The practitioner is not necessarily against diagnosing and assisting with, whatever is needed for you to heal. in order to be actually cured of whatever the problem was, they probably want to do that. But according to a lot of training that we receive, certain things are not curable, we are told. Some things, we are told, are lifelong problems that will have to be managed for the rest of your life. And the problem here is that once the establishment declares some ailment to be uncurable, anybody that tries to cure that, or maybe, even succeeds in curing it, or maybe they didn't cure it and you just had a spontaneous healing from whatever it was, that person is automatically, by definition, by the establishment, that person is automatically a fraud and a quack. How's that? So, alternative practitioners that believe in healing and believe that things can be cured, alleviated, that you could be released from lifelong management of a problem. Any of us that believe in that kind of thing for these ailments that have been declared uncurable, we can't talk about it. We can't say anything. We can't really be upfront about it. And if you did have a healing or your condition was cured and you no longer needed lifelong management, you would be told, no, it's not cured. We don't know why you don't have the problem right now, but it'll be back and you need to stay in your management program. And the two things that kind of stand out in my mind as being in that category are periodontal disease or gum disease and sleep apnea. Those two things have been declared uncurable. Once you're diagnosed with either of those things, you are now obligated to lifelong management of those problems. You have to wear a CPAP the rest of your life or an oral appliance. You will be going in again and again and again for your gum disease to get the deep cleanings and the numbing and the, root planing and et cetera, et cetera. So that's what, the environment is that we as practitioners work in, that we can't do anything about directly. And so if you hear your favorite practitioner saying, well, we can't really say that we can make this thing go away, but we can manage it like this and this, it isn't necessarily that they don't believe in, healing and that things can actually heal and be cured and that you wouldn't be roped in the rest of your life. But they're not allowed to discuss it. They could lose their license. That's what we contend with. That's what we have to deal with. So that is unfortunate, but I just want you as the patient population to be aware and to do your own research. And if you believe in healing and you believe something can be cured, if it isn't healed and it isn't cured, stay in your management. If you still have the problem, stay in your management track with whatever things that they've prescribed or given you to deal with the problem. But do not, my advice is do not let go of your belief and your faith in what your body can do. If there have been healings and cures, the establishment generally considers those to be anomalies and outliers, and they don't generally include that when they're talking about, those problems. So that's just the way it is. So conventional versus alternatives. In every area of dentistry, there are ways to do things that are less traumatic to your teeth. My main thing when I'm treating your teeth, when we actually get down to the business of doing a procedure for a tooth or your gums or anything, is to keep it as atraumatic as I possibly can, because anything I do, that means I'm extremely gentle in the handling of your tissues, gentle in working with your teeth, so that I don't upset and irritate the nerve inside the tooth. Why? Why do I work that way? The teeth are not, even once they're numb, they're not just little little rocks in your mouth to be carved and sculpted. They're not inanimate. They are part of your body. They're alive. And in most dental offices, if they work on a tooth and the nerve devitalizes, that means the pulp dies and becomes necrotic. In the mainstream conventional practice, that is simply something that happens occasionally, and they just shrug and say, oh, well, that happens sometimes. Schedule a root canal. Well, there are a lot of holistic patients out there that come to offices like mine that don't want root canals for a lot of reasons. And that's a topic for a different show, or I may touch on that a little bit more in this show, in the next segment. But, there are people that would not choose a root canal for a number of reasons. And so if their nerve devitalizes, which is a nice way of saying dies, which is the blood vessels and nerves inside your tooth that live in there and feed the inside of the tooth, feed your tooth. If that tissue becomes infected or necrotic, then you either have to get a root canal because that's gangrene. Necrotic soft tissue is gangrene. That's what it is. That's medically, that's what it's called. And if it was anywhere else in the body, you would never leave it there. But root canals are done, and then people live with a root canal treated tooth, and they can only get so much of that. They get a lot of the old pulp tissue out of there, but it's not 100%, and they are not sterile either. So what is your only other option? Extraction. So if I do something and I'm too rough, or your tooth is already kind of teetering on the edge, and I'm going to be as gentle as I can so that we don't push it over the edge and end up with a dead tooth. A lot of people, if their tooth dies, if the nerve dies, they will have it removed instead. And so that's tooth loss. That's a very, very big deal. It's a very big deal. It's an amputation of sorts. It's a fairly easy place to replace it and continue to function, but still it's a loss of a body part. And it's sad to see people losing teeth. So I focus on the most gentle possible techniques. Sometimes those techniques take a little bit longer. So maybe I'm not doing as many procedures each day as some other dentist. And maybe you have to sit a little bit longer in the chair so that I can work very, very gently with a tooth that's at risk. And that's just the way it is. That's the way I work because I don't want any teeth to die, and I don't want people to have to choose between a root canal and an extraction. All right. You are listening to Dental MD. I'm Dr. Jessica Sapoff. Today I'm talking about conventional versus alternative choices in dentistry. And if you have any questions about this topic or any other topics I've covered in the archived shows, give us a call, 425-427-8899, or reach us by email, appointments@naturaldentist.com. I'll be right back after this break.
I'm Dr. Anthony Lazowitz, and this is Climate Connections. Switching your light bulbs to energy-efficient LEDs does not just lower your electric bills. It also reduces carbon pollution and global warming. Ralph Cavanna of the Natural Resources Defense Council says LEDs are one of many recent innovations in energy efficiency. When used by homeowners, businesses, and utilities, the benefits quickly add up.
When I started my work in the 70s, everyone assumed that in order for economic growth to occur, energy use had to grow just as fast or faster. And on that logic, a healthy and growing economy meant an inexhaustible appetite for giant new polluting power plants. Coal and nuclear were the typical orders of that time. What's happened since is an energy efficiency revolution that has completely broken the linkage between energy use and economic health. Since the mid-1970s, the U.S. economy has more than tripled in size, but total energy use is up less than 30%.
Coal still supplies a lot of the nation's energy, but as the U.S. transitions to more wind and solar, Cavanna says efficiency remains important.
Energy efficiency improvements allow that clean energy to go further.
So changing light bulbs helps create a brighter, cleaner energy future. Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150. We're on your radio at 1150 a.m. We're on your HD radio at 98.9 Channel 3.
So many ways to listen.
We're on the web at 1150kknw.com, streaming live audio and video as well as MP3 archives of many of our shows.
So many ways to listen.
And now, we're on your smartphone or tablet. Download our free app in the Apple App Store or Google Play and take Alternative Talk 1150 anywhere you go.
So many ways to listen.
Ready to shake things up? Try Alternative Talk 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today I am talking about conventional versus alternative choices in dentistry. And those terms, conventional is kind of interchangeable with mainstream, but I like to say conventional because I don't want to get us locked into mainstream being conventional, because actually I believe that holistic care is becoming mainstream. Little pieces of it are trickling in and becoming more mainstream. So I'm reserving the word mainstream for whatever is the dominant idea in medicine and dentistry. And I think that some holistic concepts and natural medicine concepts are gaining dominance. So I want to distinguish conventional from mainstream, because conventional, I believe, will soon be getting referred to as the old way of doing things. So, and some old things are coming back too. Old concepts that were considered to be debunked, but weren't debunked, actually, will be making a comeback with new research and new prominence and understanding. So that term conventional is what I'm using to refer to the authority-approved ways currently. And alternative is, I'm using that synonymously with holistic, natural, biological, complementary, just all of the ways of doing things that are bringing in new concepts, sometimes old concepts renewed, into current practice. And those are currently the alternatives to the mainstream, used to be mainstream, conventional ways of doing things. So alternative treatments are, right now, dentistry is still, the patients are much more open to holistic and natural medicine concepts than the practitioners. And I've been to courses where they warn us practitioners about those internet mothers. Yeah. And I'm sitting in the audience listening to this, and I'm an internet mother. Everything they said about the internet mothers as like a slur, I'm sitting there thinking, that's me. Yep, I looked that up too, and yep, anyway, you know who I'm talking about, and it's probably you too, internet mothers and fathers out there, internet grandparents, saying, hey, I read this, and maybe we should wait on that vaccination since your kid is sick, right? Or maybe not do the vaccination at all, depending on what you've read and what you know and believe about vaccinations. But at the very least, but that's what they're referring to. Oh, we can still do this procedure. You don't, you read that somewhere on the internet. It has no validity. I'm telling you what the real information is that comes from my authorities. Okay, so that's what you're still going to find, that attitude in most dental offices. So when you go for a second opinion, are you really getting a second opinion? You're getting a second conventional opinion? Maybe you're going to hear somebody else's style differences, or maybe they'll do something in a different order, or maybe they're willing to do an inlay instead of a filling, but you're still getting conventional thinking based on the current authorities training us to do things certain ways for patients in certain circumstances. So if you really want an alternative opinion, because when I say second opinion, what I mean to say is alternative opinion. You want an opinion from somebody who, and you can get more than one conventional opinion and more than one alternative opinion from more than one holistic office. You may have to pay a fee for an exam and have your x-rays transferred over, or get a copy of them and just walk in with them is fine too, usually. And get more than one holistic opinion as well, because holistic offices are much more different from each other than conventional practices are. And there's no such thing as alternative dental school. There's only authority dental school. There's no alternative dental school. There's no natural dental school. Anyone that's practicing holistically or according to the principles of natural medicine has learned how to do this after dental school. We all go to conventional dental school. We all have to place mercury fillings while we're in school in order to pass, in order to be given a degree. And most parts of this country, dentists still have to place a mercury filling into a tooth correctly in order to get their license. There are only a few exam areas in the country that have switched and will allow the licensure candidate dentist, to place a resin filling in a class 2 area of a tooth. It's a particular location on the tooth where the cavity is. You've got to show that you know how to fix those class 2 restorations, and class 5s and class 3s and all that kind of stuff on your exam. And there are only a couple of areas in this country that I know of that allow the candidate to select to do a resin filling instead of a mercury filling. So when I was going through that process, it's actually very fortunate that I didn't know everything about mercury that I know now, because I really, looking back, I would say I would not have been able to do it. I had to place mercury fillings in children and pregnant women and you name it. And I look back on it and I don't feel good about having done that, but at the time that was what we were told to do in order to graduate, in order to get our license. And at that time I didn't know anything more about it. I learned about these things after I got out of school. But the difference between a lot of the holistic practitioners and conventional practitioners is that when we heard about mercury and that it might not be such a great idea to put it permanently in people's teeth, something inside of my head went off and said, hey, mercury is toxic and maybe we shouldn't be putting it in. That made sense to me. But my training told me that when I hear something like that that's against what my training was, that I should tell whoever's asking me about that. A patient comes and says, hey, I heard mercury's bad, I was supposed to tell them, no. The research shows that mercury is completely safe and it's perfectly fine and it lasts, these mercury fillings last longer than everything else and it's the best treatment for certain parts of your teeth and blah, blah, blah. And there's no research in existence that shows that it's toxic. Well, that's what we were taught to say. And so that's what most dentists still believe. However, with the cosmetic dentistry industry making so much money hand over fist for so many years, cosmetic dentistry really, all of us learn cosmetic techniques because we all have to learn to make, the teeth look natural, restore them back to a natural shape using materials that look natural. And for some reason, it was okay if your back teeth were all filled with metal as long as your front teeth looked natural. So cosmetic dentistry was the beginning of putting beautiful restorations in back teeth where nobody sees it or you don't see it as easily. That was what cosmetic dentistry was changing your whole mouth over to completely beautiful, natural-looking teeth. But because the cosmetic dentistry movement was not a natural or holistic movement, in the effort to make your teeth look beautiful and natural, they would drill out the old and ugly metal fillings and crowns and put in the new beautiful things. And a lot of patients went in thinking, good, I'm going to get rid of this mercury and have nice, resins and ceramic. But unfortunately, these dentists still didn't believe that the mercury was toxic. And so they were drilling it out. They're breathing it, the dust and the fumes. You're breathing and swallowing particles of mercury and breathing the vapor as it's being drilled out. There was a lot of very big, and still is, a lot of unnecessary exposure to mercury during removing old mercury-containing fillings. And that is still the case. So as a patient, you have to be aware of, make sure that the dentist that's going to be drilling out some old stuff is going to take the precautions that we all holistic dentists do. If somebody says they're holistic, they are probably taking some kind of precautions to protect you and the office and the staff from unnecessary mercury exposure. All right, I'm going to continue talking about this particular issue when I return from the break. You're listening to Dental MD. I'm Dr. Jessica Sapoff. If you have any questions, give us a call, 425-427-8899. And you can reach the front office email, appointments@naturaldentist.com. I'll be right back.
I'm a veteran. My victory was admitting I had PTSD and getting help.
As America's veterans face challenges, DAV is there.
I no longer see it as a weakness, but as a sign of strength. I call it post-traumatic growth.
DAV provides a lifetime of support, helping veterans of every generation get the benefits they've earned.
I am a veteran. I lost both legs in Vietnam.
Every year, DAV helps more than 1 million veterans so they can reach victories great and small.
My victory was getting my benefits and a good education.
I'm a veteran. When I got out, I felt like nowhere was safe. My victory was finding the help I needed.
But there's more to be done and more victories to be won.
Thanks to DAV, now I feel like I'm human again.
Help support more victories for veterans. Go to DAV.org.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but But did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
There's a reason they invented the internet. It's called 1150kknw.com.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today, I am talking about conventional versus alternative choices in dentistry. And in the last segment, I was starting to talk about mercury and the importance of just making sure that whoever is removing any old metals of any kind, including mercury fillings, but there are a lot of other metals in old crowns and things, and there might be mercury fillings under an old crown, and you want to make sure that they completely remove that if removing mercury is your goal, which I think is reasonable. You want to make sure that the person that is doing that treatment agrees that mercury is toxic and that they're not just removing it because it is ugly and unnatural looking in your mouth and looks gray and black in your back teeth. So it has to be removed using safety protocols, and there are a lot of different safety protocols. There are some out there that are claiming that their safety protocols are better than everybody else's. Don't fall for that. There are a lot of different ways to do things safely. Have the office where you're going explain what their safety protocols are. If you have to have metal removed, they should be using those protocols, whether it's mercury or any other metal, and it should be protecting you from breathing or swallowing any of it, and it should be protecting the office air as well. So that way, when it's finished being removed, you don't stand up and walk around and breathe mercury vapor that got in the air. That's, the indoor air quality is also an extremely important component of this. So you also want them to not just be all about getting your mercury out. They also need to be about doing it gently so that the nerves in your teeth remain happy. If it's done quickly, and there are some people that say it should be cut into little chunks and kind of pried out in chunks because that way there's less dust. Well, prying stuff out of teeth can cause cracks in the teeth. Or if you already have a crack, it can make the crack go so deep that your tooth dies. So I'm not a fan of prying anything out of teeth or off of teeth or anything, because my two main goals are to be as gentle and atraumatic as possible and to safeguard you from exposure to any chemicals that could be detrimental to your health. And some of these we know absolutely are detrimental to your health when you're exposed. And not everybody can excrete mercury very well, and some people accumulate it. So that's something to discuss with your physician. You might want to see a physician that's knowledgeable about heavy metals and other metals, and make sure that you are, detoxing according to principles of toxicology, which means, there are very well-known ways to detox, and there are some newer, wonderful new compounds and supplements and things that can be taken and added that are extremely effective at helping your body excrete metals and other toxins, but you have to make sure that it's being grabbed and that it's actually getting out of the body and not just being dumped by your cells and swirled around only to be reabsorbed. Because that secondary exposure, when you reabsorb this stuff that's been allowed to swirl around in your system now, that is tantamount to another exposure to all of those nasty toxic materials. All right, so talk to someone knowledgeable about toxicity and talk to dentists that you might want to go to, get multiple opinions if you want to, and then settle in on a place where you feel safe, that they are knowledgeable, that they have acknowledged that they agree that things need to be done safely, and also that they're going to take the time to do things gently. So that's been my way of doing things for a very long time. And unless a tooth is already chronically painful, if it's, there's a point where the nerve is already kind of past the point where it would normally be able to recover. That doesn't mean it can't recover, but it's not likely to. And so a lot of offices will sort of, if your tooth is sensitive at all, they'll be like, oh, that tooth's probably going to need root canal. Just go ahead and go get a root canal. And then they'll do the crown on it. And then it's all done. And I don't agree with sending people to make that choice of root canal versus extraction unless I am absolutely certain that the nerve is necrotic. But because most dentists don't think that you're going to choose the option of extracting a tooth rather than get a root canal, what they do is if they think that you might eventually need a root canal on a tooth, they simply send you to go get the root canal so they don't have to deal with it later, so that you don't, the intentions are good. They don't want you to have a sudden abscess and toothache pain and swelling. And teeth, when they die, it can be pretty much fireworks. It's terrible. Your whole life grinds to a halt until you deal with it. If your tooth gets really hot and kind of the nerve blows up on you like that, it's very, very painful. And so in an effort to save you from that, they will send you to get a root canal before your tooth actually is dead or needs one, in my opinion. I really think that a lot of the time teeth can still recover if they're treated gently and, and you do the things that promote healing in terms of nutrition and avoiding certain things and doing certain things. So I like to give teeth every possible chance to recover. And yes, sometimes symptoms will increase instead of decrease. Then you got to make that decision, either get the root canal or get the tooth out, or wait a little longer if it's not, if it's still kind of intermittent, hurts sometimes, doesn't it? But, this is another one of those things where a root canal is a root canal and extraction is an extraction. However, our conversation about what your choices are there and, the decision-making process, and is it time to make that decision yet? Is there something else we can do first? Is there something that, that conversation, those choices, that takes time to sit and have that conversation. It's much quicker to just say, your tooth hurts sometimes, so here, go get, I'm not sure, it must be the nerve dying, go get a root canal. And, that hasty decision-making, which saves a lot of office time because there's a lot less conversation and less, check it again, see if it's improving, that kind of stuff. I'm more about making sure you don't get an unnecessary root canal or lose a tooth that doesn't need to be extracted. That's more important to me than whether we spend some extra time in the office talking about those choices and working with, your preferences and your teeth to try to maximize your chance of keeping your teeth for a lifetime. So it's those conversations that set a holistic or natural practice apart from the conventional way of doing things, which is very expedient and profit-oriented. So I wanted to just highlight the differences between conventional practice and alternative practice and some of the things I've talked about are my way of doing things alternatively, and every office is going to be a little bit different. So if you have questions or you want to make an appointment and come see us and have something checked or get an exam and a cleaning or a procedure, give us a call, 425-427-8899, and you can email us with questions, and we'll answer your questions by email or phone so that you can decide whether my practice is where you want to go for that treatment. So appointments at naturaldentist.com. Thank you very much for listening.
The views expressed on this program are those of the host, guests, and callers, and not necessarily those of KKNW, its management, or other advertisers. Contests are the responsibility of the host of this program and not KKNW. This is Alternative Talk 1150 AM, KKNW Seattle, and KNUC 98.9 HD3 Seattle.